And Jumbo, dear listeners and viewers, the month of September has been set aside worldwide to be the month to create prostate cancer awareness. Uh, and this is important because we realize that unlike Breast Cancer Awareness Month, uh, we don't seem to be getting enough awareness during this month of September regards to prostate cancer. And probably the reason is because men have a poor health seeking behavior. So this month has been set aside to create awareness amongst men, but also amongst women, because we appreciate that women can be the force who might be able to urge their men to go to hospital to be checked. The prostate is a gland which is just below the urinary bladder. It is a sexual organ which produces a part of semen, which is important in transportation of the sperm for fertilization. And this organ, as I've said, is just below the urinary bladder, and therefore, if it becomes too big, then it can compress the urethra, which is the pipe which takes urine from the bladder to be urinated by the urethra. It's important to mention that most prostate problems are not cancer, but they are rather some benign process, what is usually called a BPH, benign prostatic hyperplasia. And this is the commonest prostate pathology. This is what actually affects many men. And some of the symptoms of prostate enlargement or BPH include being unable to fully empty your bladder, and therefore, because of that, you find men who are getting elderly, they get urge to keep on urinating. Sometimes when they go to urinate, they are not able to fully empty their bladder, and therefore, then they end up with the urine dribbling into their inner garments, and giving them some characteristic bad smell. Again, because of the incomplete emptying, then you find men can also be having a regular urination, and then also the urge when it comes might be too much, and sometimes you might find some men, especially the elderly, unable to get to the urinal to urinate when they get the urge, and then they pee on themselves. And of course, because of the incomplete emptying, then infection of the bladder can be frequent, and but basically more or less that's the biggest problem which affects the prostate. And the solution for that is either to get drugs which can make the prostate smaller and allow the pipe to allow urine to be able to pass and be voided, or surgically where then the enlarged prostate can be removed. But then when it comes to prostate cancer, this is the commonest cancer among men, and these are cancer which is a silent killer because, as I've just said, where the prostate gland is situated, a number of times men don't realize they have that problem, and even when they have their symptoms related to enlarged prostate gland, a number tends to ignore, either because they feel embarrassed or because they don't know. But usually prostate cancer most of the times is not symptomatic until it has spread too much. And the reason for that is because normally cancer of the prostate starts at the periphery of the gland, and therefore rarely does it compress the urine tube, the urethra which is passing through. But some of the symptoms can be similar to the ones you have for enlarged prostate: the regular urge to urinate, the inability to completely empty your urinary bladder, dribbling, again a weak stream of urine when you go to pee, then also the regular urination and the inability to hold your urine. The moment you get the urge, before you get to the urinal, you might pee on yourself. But then other symptoms might include, enough for prostate cancer, might include blood in urine, And if the cancer has already spread, might be getting low back pains and also bone pains. And prostate cancer, if caught early, can be managed well. And therefore, that's why we are creating this awareness so that for men who are 40 years, 45 years and above, you need to see your doctor. You need to go to hospital and be screened for prostate cancer. This can be done, the screening, by either a blood test called a PSA test, or even a test called a digital examination, where the doctor uses their finger to try and feel the prostate to see whether it's enlarged and feel how it feels well. Because by training, doctors are able to tell by feeling that gland whether it is just enlargement, whether it's malignant. And then of course, after that, then if the PSA levels are elevated or the digital rectal examination feel is suspicious, then the other tests can be done, including an ultrasound and also a biopsy using a needle to get a bit of that prostate gland to be able to be tested in the lab to know whether it's malignant, whether it's cancerous or not. And then from that, there are different management modalities. There's surgical, there's chemotherapy, there's radiotherapy, but more often than not, when it's cancer, then the treatment is combined. So mine is to urge all men and also women who are men in their lives to urge to create this awareness amongst men that September is a month set aside to create awareness about prostate cancer. Let all men above 40 years of age get to hospital and be screened for prostate cancer. Thank you.